name's
Hello,
Jill.
how you doing?
I'm the nurse manager. I'm going to interview you. Thank you for coming. I'll have you take a seat when you're ready.
Okay.
So I have just a couple questions I want to ask you just to get to know you a little better. Let's start with, why did you become a nurse?
Well, when I was little, my mom used to take me on her home care cases. She used to listen to alarm sounds in the car and stuff. Like, it really hooked my interest. And then when I graduated high school, she put me into school to be a CNA. So ever since then, I just stayed in nursing and I love it.
Beautiful.
So she hooked my interest in
Good. And started at a young age, sounds like.
it. Yeah.
That's awesome. Good for you. Well, what skills and personality traits do you think are important for a nurse to possess?
Definitely effective communication.
Sure.
You need to be able to communicate with coworkers and patients and doctors, so active listening, definitely. Ability to use medical equipment. I do have a lot of experience with that, and definitely time management skills.
Time management is definitely important as a nurse.
Yeah,
Absolutely.
definitely.
Good. So imagine a patient's family criticized your care. How would you handle it and what would you do?
I definitely actively listen to the patient, just let them talk, get their everything out, and then inform them that I hear their concerns and I'm gonna go speak to the unit manager. But if there's anything I can do on the spot, then I would, but I would probably need to communicate with the unit manager and, if necessary, do incident reports, whatever.
Good. I like that you say that
And
you
then-
validate the patient
Right.
first, yeah, because
Right.
that's always important to make sure that they're heard, like you said,
Definitely.
and take the appropriate steps. I like that. That's good. Well, how well do you thrive in a fast-paced environment?
I am an LPN. I previously worked in, well, I was an LPN. I previously worked in long-term care where I had 27 patients. So that med pass got crazy at
Sure.
times. You have to be fast-paced.
Sure.
I've been in code situations, so
Oh, wow. Okay.
that's a high-stress situation.
Sure.
Fast-paced, definitely. And I think I have the ability to stay calm.
Sure.
And you just gotta take your breaks too, so you can come be refreshed at some point in the shift.
And it's good that you have some experience with that already.
Definitely helps.
So, what do you think are the biggest challenges nurses face?
I would say time management with 7 patients. Well, 5 to 7. Usually it's gonna be 5. If I'm correct on that.
Right.
But time management definitely, because they all have their issues and they need to be prioritized.
Right.
So that's a challenge, and communicating with the doctors and the patients. That's another challenge, I think, in nursing.
Right.
You have to make sure the patients are educated, and you're communicating their changes and their needs to the doctor.
Sure.
So that's definitely 2 major things.
Yeah, those are definitely major things that nurses face. So I think you answered that question completely correctly.
Thanks.
Last question that I have for you. Would you rather work independently or with other nurses?
Definitely as part of a team. Nursing is a profession where you need input because things aren't always cut and dry. You need to collaborate with your fellow nurses on the floor. Like, what do you think about this? You know, can you listen to these lump sounds? You know, stuff like that.
Right.
Like, I think that's definitely major in nursing.
Yeah, teamwork is definitely a big thing for nurses,
Definitely.
like you said. All right, Lauren, everything looks fantastic. I have your resume here with me as well, so I'm gonna just take a look at that again. Really enjoyed our interview, and I will be in touch with you, okay?
Okay, thanks so much.
Oh, you're welcome. It's very nice meeting you. Have a good day.
You too.
Thanks.
Bye.
Bye.